Thank you, Mr. Chairman. Thank you all for coming today. I understand centralization and standardization of a system this large nationwide is a monumental task. I also understand the benefit this effort could create for staff and patients alike. However, it obviously sounds as if right now it's been an absolute failure. So I want to start with you, Doc, on the end. Knowing that you and the rest of Americans continue to pay for this debacle, Doc, what level of confidence do you have in partnerships, the current partnerships and leadership engaged in this effort? I'm really asking clearly about your level of confidence moving forward.
Thanks for the question. Obviously, it's a hugely challenging process and a daunting task. I think I've been very pleased to see Dr. Evans' leadership and understanding of the issues and commitment to stop and take the time we need to get this right and not push forward when things are not safe or when things could be improved.
So what's your level of confidence? That was a question I asked you.
In what? In an individual, in a process?
Yeah, in the partnerships that we have, the company that the corporation company that you're working with, and in the leadership that you have.
I think I have a moderate level of confidence.
Okay, moderate. Ms. Nelson Brooks, what about you, ma'am?
In terms of my level of confidence in or leadership's ability or their commitment to getting this right, I would say I have a high level of confidence. I believe that Dr. Evans, Dr. Elnahal, Secretary McDonough are committed to fixing the system as it exists currently. In terms of Cerner's ability to meet our needs, I would say my level of confidence is a lot lower. On a scale of 1 to 10, I would give it a 5.
Ms. Nelson Brooks, do you think that we should scrap what we're doing and go back to the old system based on what you are observing and the percentage of your staff that seems to be very disappointed with where things are?
I agree that our staff are very disappointed with the way things have gone. I do not believe that we're at the point currently where we need to pull the plug entirely.
What's the biggest effect that you've seen on patients with the rollout of this new system?
The biggest effect for our facility has been our increase in wait times. Pre-Cerner, we were able to see new patients in for primary care appointments in less than 30 days. Currently, our new patient wait times in Eugene, one of our largest facilities, is approaching 80 days. And for Roseburg, our other location, it's over 80 days. It's closer to 85 days for in-person care. The caveat that I will mention there, however, is that if patients are willing and able to be seen by telehealth, we do have the ability to get them in within 7 days.
Doc Fisher, what's your level of confidence?
I would agree with Dr. Ahrensman. I would say it's moderate.
Moderate? What would you like to see going forward, Doc?
Improvements in the functionality of the system, less degradations, more user satisfaction, things you would anticipate you would see with a successful electronic health record.
Are you saying that most of your disappointment is in the partner that we've chosen here?
Hard for me to say, sir. I'm not an expert in IT. All I know is that our employees are fatigued, tired, stressed. They feel like they're the individual that stands between the health record and making our patients safe, and they have been largely successful, but at a cost.
Mr. Kelter, same question for you.
I would say between the commitment of our leadership from the Secretary on down to the recently renegotiated contract and the fact that we have 1-year contract options instead of a 5-year contract option, and the current reset period, I think our chances are better now than they have been in the past.
Doc Evans, did I hear you say you've been doing this role now for 6 months?
That's correct.
Are you ahead or behind of where you thought you would be coming into this at the 6-month mark?
I would like to have been further. So I don't think we're, I think the changes have been slow and incremental. They need to accelerate. Anytime you are starting the reset and sort of retooling for moving forward, it's going to take a little time to get the engine running and to build the momentum that we need to build. So am I proud of the organization for listening to this committee, for making the right decision on behalf of veterans and the staff that you know or you've heard are represented by the folks to my left? Absolutely. We made the right choice to reset. But we still have a lot of work to do, and we are committed to doing it.
Thank you, Mr. Chairman. I yield back my time.